Hello, my name is Dr. Gary. I am one of the pediatricians at Premier Pediatrics here in Cedar City, Utah and Hurricane, Utah. Today I'd like to talk to you about fevers. Now this is an incredibly broad topic with many potential causes. The main purposes of this video are to focus on the infectious causes of fever and what fevers are okay to treat at home and what other ones would warrant additional workup by a physician or by a healthcare provider. So a normal temperature is typically between 97 degrees Fahrenheit up to 100 degrees Fahrenheit, with a typical cutoff for fever being defined as temperatures at 100.4 or 100.4 or greater. Now there are special considerations for infants who are 90 days and younger that I will talk about more at the end of this video. So these initial recommendations are applicable to otherwise healthy children, infants older than 3 months, children, adolescents, and young adults with otherwise healthy, normal functioning immune systems. So a fever is our body's response to infection. Fevers, in fact, help us to fight off most infections. A fever in and of itself is not necessarily a bad thing, but sometimes children, when they get fevers, they become uncomfortable, don't want to drink anymore, and that can lead to dehydration, which that can in fact become a bigger problem. So in general, for a fever, it is okay to manage it for a few days at home. And if your child has a fever and is otherwise happy and drinking well, you don't necessarily have to give anti-fever medicines. If your child has a fever and is uncomfortable, then again, it is perfectly warranted to give medications like ibuprofen or acetaminophen to try and help the fever come down. Again, having a fever is not dangerous, but again, in most cases, again, is not dangerous, but again, it's just a sign of an infection. Now, there are special considerations that I will, again, talk about more specifically at the end. For younger infants, generally, I say the younger that they are, the sooner I would have them have an assessment by a healthcare provider. So someone who is 6 months old and has had fevers for 2 days, I would advise that don't seem to want to go away. I would advise them to see a physician sooner than a 16-year-old adolescent that has had fevers for the same amount of time. Older adolescents, again, can easily go 4 or 5 days without being assessed by a physician, since the common cold, which is the most common cause of fevers and illness, can last anywhere from 4 to 7 days. And again, not everyone, again, that has a fever beyond 2 days needs to be evaluated by a physician. Each case is a case-by-case basis, and again, I reiterate that this video is not meant to supersede other medical advice that you've been given by your own primary care provider. There are certain times when I would say a child should be evaluated sooner in the office, and that would be for more serious signs or symptoms, such as a temperature of 104 or greater, a child who is complaining of a stiff neck, a child who is complaining of severe headache, or any severe pain, severe vomiting, or in general, just any parent who is worried about their child. Again, all of these things warrant consulting with your own physician and an evaluation. There is an additional component that I will talk about, and that is infants, children, adolescents that are unimmunized don't have protection against some of the more serious causes of fever, such as bacterial meningitis. And thus, my threshold of recommending that someone go have an evaluation by a medical provider is lower if they have not been immunized, again, because they lack the typical protections against things like bacterial meningitis, bacteria in the blood, and some of these other potentially very serious conditions that immunizations help to protect against. Going back to what I was referencing in the earlier part of this video of infants under 90 days old. So infants in this age group have immune systems that are immature and that are not fully functional yet. And with more age, they will become better armed at protecting themselves against infection. But because infants, particularly under 60 days old, are more prone or have immature immune systems, if they come in contact with a cold or a very serious bacteria that causes infection in the brain or the spinal cord, In the beginning, all they may have is irritability and a fever. And actually, in this age group, the way to get an accurate temperature is through measuring a rectal temperature. So again, our recommendations are for any infant who is under 60 days old. This is in fact considered a medical emergency and should be evaluated and worked up in the emergency room. Again, not that the fever itself is dangerous, but rather what the fever could represent is dangerous. For infants that are 60 to 90 days old, this is an age group where it's still considered a medical urgency, but not a medical emergency. So any infant between 60 to 90 days old should be evaluated by a healthcare provider as soon as possible, but typically does not require driving to the middle of the night, such as it would with an infant who is under 60 days old. Just to summarize, again, a fever is just a symptom, our body's response to infection. Fevers actually help our bodies to overcome infection, but there is, too much of a good thing, and too much fever can make children feel uncomfortable, and that can make them not want to drink, and that is more often the problem. So giving medicine to help control their fevers so that they're more comfortable, still want to drink, trying to manage symptoms at home for 2 or 3 days, and the younger the infant, the lower the threshold should be for having a doctor or a healthcare provider evaluate your child. But someone who is immunized, maybe a little bit older, again, they're the ones where it's okay to wait a little bit longer at home just to see if their own immune systems can overcome the infection that they may have. If you have any further questions or concerns, again, a reminder that this video is not applicable to everyone, and it's generally is meant to be for those healthy, infants, children, adolescents, and young adults who have otherwise healthy and functioning immune systems. As always, follow the advice that you individually have received from your healthcare provider, and take these tips and tricks as general recommendations. If there's any one thing that I have learned, that is to trust parental intuition. And so even if your child may not fit, or even if your child does in some degree fit the okay to watch at home symptoms for a few days, but there is something about your intuition that says that something is wrong or your child should be evaluated, I implore you, those intuitions should be trusted, and your child should have a medical evaluation. So again, from Premier Pediatrics, my name is Dr. Gary. I hope you have found this video to be helpful, or at least somewhat helpful. We at Premier, we're accepting new patients and love to meet your family if you guys are looking for pediatric practice.